medicine. There are no organizing principles that help us navigate the territory of chronic disease. Functional medicine is that breakthrough theory, the biggest breakthrough idea in medicine since the discovery of the microbe and antibiotics. It is a cataclysmic shift in our view of biology. There are moments of awakening in science that are not incremental, but transformational. Columbus proving the Earth was round, not flat. Galileo showing us the Earth was not the center of the universe. Darwin explaining that species evolved and didn't arise fixed in their current form. And Einstein shattering our notions of time and space. Functional medicine is a paradigm shift of equal magnitude and significance. Disease appears real and fixed, just as the Earth seems flat, and time and space seem linear and solid. In The Disease Delusion, the father of functional medicine, Dr. Jeffrey Bland, the man who has synthesized more medical science from more fields of study than any other human in the past 30 years, shatters our notion of disease. Disease, as we think about it, is a false idol. It does not exist in the way we think about it. The names we give diseases are useful for finding the right medication, but not for truly getting to the cause or creating a healing response. When we tell a patient who has symptoms of sadness and hopelessness, who can't sleep, who lacks interest in daily activities, food, or sex, that he has depression, this is not helpful. Depression is not the cause of his misery. It is merely the name we give to this constellation of symptoms. We then treat these symptoms with an antidepressant, which works only a little better than chance. The actual cause of the depression may vary greatly from patient to patient. It may be a leaky gut caused by gluten that activates the immune system to produce antibodies against the thyroid, leading to low thyroid function and depression. It may be a vitamin B12 deficiency resulting from long-term use of an acid-blocking drug for reflux, or a folate deficiency caused by a gene called MTFHR, or a vitamin D deficiency resulting from inadequate sunlight. It may be a mercury toxicity from a diet too high in tuna, or an omega-3 deficiency from a diet too low in fatty fish, or prediabetes brought on by a diet high in sugar. The symptoms may arise from changes in brain chemistry brought on by life trauma or stress, or even by alterations in the gut flora resulting from antibiotic use. Each of these factors, dietary, environmental, lifestyle, creates a different imbalance, yet all cause depression. Knowing the name of a disease tells us nothing about its true cause, nor does it lead us to the right treatment. This is the disease delusion. As a student of functional medicine for 20 years, and as a practitioner who daily faces the failures of our current medical model and witnesses the miracles of treating illness using this new medical paradigm, I feel strongly that we are on the verge of a true transformation in medicine. Functional medicine is not simply about improving diet, or getting more exercise, or managing stress, or reducing exposure to environmental toxins, all of which are critical foundations for creating a healthy human. Above all, functional medicine is the science of creating health. Disease goes away as a side effect. Functional medicine is a personalized method for getting to the root of symptoms and restoring balance. It is the story of a little girl, Elise, who had suffered from intractable psoriasis with red, weeping, raw skin from head to toe since she was 6 months old. Her parents had taken her to the top medical schools, and she had been given the most advanced drugs, including powerful immune suppressants and chemotherapy to shut off inflammation. When I first saw Elise, she was 4 years old. She had just emerged from a month in the intensive care unit after fighting a life-threatening staphylococcus infection triggered by her medication, Enbrel, which suppressed her immune system. Rather than inquiring about the root cause of her inflamed skin, doctors used medication to suppress symptoms. Still, she was no better. No one asked about her diet, or thought about how her history of antibiotics as a baby affected her delicate gut flora, thus setting up the conditions for inflammation. Functional medicine led me to a different set of questions. Rather than asking